Today, in Time with Thebsian, I will be talking about how a medical device is made. In this episode, I will give an example of a medical device and explain when the medical practitioner needs a medical device, how he makes a team and goes forward to make a medical device. In this example, I am presenting before you how we make a stent. The doctor or the medical practitioner would like to have a device which can be placed in a narrowed down vein or artery or a urethra so that narrowed down portion will be expanded and will become patent. That means there won't be any block and the blood can be smoothly flow or the urine can pass through the urinary tract. Therefore, the medical man shares his idea. So the biomedical engineer will study the necessary requirement of a metal or a plastic which can be made to make a device so that can be placed in the narrowed down place. So the block will become clear and the vessel will become patent. The doctor likes the device to be so small as possible and to be placed in that particular place without a major surgery. That means the patient need not undergo a large expense and minimum stay in the hospital. So the team decides that the device should be just like a folded umbrella, and this can reach the place of blockage using a guide wire or a catheter inserted through the vein in the body. The device could be called a stent, and this device should be compatible with the body. That means the body tissue where the stent is placed should not biologically respond to the foreign material that has made the stent. Then the team of doctor and the engineers decide regarding the requirement of the device and the availability of the raw materials and physical and chemical properties of the material so that the device could be processed or produced or fabricated. The material should be having minimum rigidity along with the required flexibility, and it should be able to be sterilized before the surgery, and it should not react with the living tissue. Therefore, they present a team requires a toxicologist, and they hires a toxicologist into the team to study the toxicity and biocompatibility of the material that go into the fabrication of the device, and also a veterinary team which will finally conduct an in situ study of the fabricated device in larger animals. After this in situ study, if the product or the stent is proves to be biocompatible and very good performance at the large animal in situ test, then the team will present the report to the medical board, which will conduct a clinical trials. In the clinical trial, the device or stent will be tested in human beings. The team for the clinical trials will select patients. They will make sure that they have a consent form from the patient for testing the device in them. And the patient will be informed about the device and what the device is going to do in the living body, how device is going to clear their problems of occluded artery or a blocked urethra, and all these are done in writing, and the final report is submitted to the board of clinical trials for approval. And if the device passes the clinical tests, that report is filed to Drugs Control of India for permission for manufacture and sale of the device. This is how, in very short, how a medical device is designed, fabricated, tested, and reaches the market for sale. Thank you very much for listening. I will be talking to you next Friday.